Hi there. Have you ever struggled with your weight? Have you ever been judged by a peer? Have you ever been told you're not doing enough to help yourself? Have you ever been told that you're taking the easy way out? My name is Heather, and I have heard this more than once in my life, but particularly after I had bariatric surgery. Today I'm going to talk to you about how bariatric surgery is not the easy way out, how it is a long process to get there, how it is a physical and mental challenge afterwards, and how it is by no means easy. There are 3 types of bariatric surgery: lap band, gastric sleeve, and Roux-en-Y. Lap band is a band around the top of the stomach that restricts food from going down quickly, which causes the nerve at the top of your stomach to tell your brain that you're full quicker, so you eat less. Not very invasive, it is removable, it's the easy of the options. In the last 10 years there have been more complications, they don't tend to do these anymore. So the next more common option is the gastric sleeve, where they remove a portion of the stomach, leaving a sleeve-like portion left, which is less circumference of the stomach to fill with food, again doing the same thing, telling that nerve to tell your brain that you're full quicker. The other option is Roux-en-Y, which is where they staple off that same section of the stomach that they would have removed with the gastric sleeve, but they do not remove it, and they rewire your gastric system, your digestive system, so that it goes through quicker. Good candidates for these types of surgeries are patients who have BMIs over 40 or 35 with a comorbidity, which would be like diabetes, high blood pressure, or cholesterol. They might also have sleep apnea or a sleeping disorder that would cause them to stop breathing due to their excessive amount of weight. They want patients to have at least 100 pounds above their ideal estimated weight, to be over the age of 18, and to also have tried non-surgical weight loss methods that have been documented with a physician beforehand for a certain amount of time. This is a committed lifelong journey, and if you're not mentally stable enough to take that seriously, they don't recommend that you have these types of surgeries. The University of Michigan, their bariatric research team states that in the U.S. alone in the last year, there are said to be 100 million adults who struggle with obesity, that 30 million of those adults also struggle with diabetes, that there are 75 million adults in the U.S. who struggle with high blood pressure, and that 78 million of the adults in the U.S. struggle with cholesterol, which must be controlled by medications, and that there are also 13 types of cancers that are associated with obesity. My parents both had lap band surgery done in 2010. They stated if I could follow the diet and take it seriously, they would pay for me to have it done, since I struggled with my weight my entire life. I was an active child. I had tried multiple diets. Nothing seemed to work for me. So at 18, I had the lap band procedure done, and in 2015, I was at my lowest weight of 215 pounds, which was about 100 pounds weight loss. After surgery, in any of these cases, you struggle with malnutrition, you struggle with the medications, the way they're absorbed, how many you have to take, you struggle with being able to stay fit, to follow the diet, to keep that full package together. You might struggle with mental health, weight plateaus, sleeping, rearranging your schedule for sleeping, as well as managing your stress levels, and then also social anxieties. From a young age, I struggled with a lot of these already, and so having bariatric surgery has only increased those and has caused me to be a stronger person because I pushed through this. This lifestyle is a physical and mental change. It's not for anyone to take lightly. It's not a quick fix. It's not going to magically make everything bad in your life go away. It is a work in process. It's a tool for you to improve things. In order to have these surgeries, you must have a predetermination from a doctor, your insurance, have a cost plan, as well as a psychological evaluation by a physician, just so they can make sure that you are ready for this kind of change in your life. There are pre-op diets in order to shrink your liver so that they can get around to the organs they need to get to. So they do all of the 3 of these surgeries laparoscopically. You spend 1 to 3 days in the hospital, depending on how you do during the surgery and after. And if you can get past all of those, the real journey begins after surgery, with your post-op diet working foods back into your life, as well as getting back to a normal routine. Every surgeon is different on what they want you to have afterwards, but all of them want to have at least 50 grams of protein daily, 64 ounces of fluids daily, as well as maintaining your supplement regimen. The American Society for Bariatric Surgery patients have talked about the struggles with malnutrition, the medications, fitness, mental health, weight plateaus, sleep stress, and social anxieties. They talk about how you have to go through all of these in order to be successful, and in order to get through these, the biggest thing is having a support system. Not only did my parents have a surgery, my two best friends did as well, and in total, my parents have each lost 100 pounds. My best friend Kelsey has lost 79 pounds since February of this year. Taylor has lost 46 pounds since August, and me, myself, had a second surgery due to complications with the lap band. I ended up having gastric sleeve done in June, and from June to present, I have lost 69 pounds. This is not something to be taken lightly. Like I said, it's a physical and mental change. I might not have any of these comorbidities as diabetes or cholesterol or high blood pressure, but I struggle daily with maintaining my diet, my lifestyle with fitness, making the right choices for myself. Like I said, this surgery is a tool, not a magic fix. And patients who can follow the recommendations will be successful. The ones who can get in that mental state of, I need to do this for myself. I have a 9-month-old that I want to be able to chase around and not have her think, why can't my mom do things with me? Patients are required to prove that they can do this with their failed attempts at other diets, that they're going to use this as a push to continue to be successful in this program. In conclusion, you can see that because, yes, the surgery does help lowering your chances of having a medical condition, it also increases your chances of having something on the mental side as well as physical, with the side effects of surgery and how you're going to maintain that lifestyle afterwards. If a patient can't be committed and driven to succeed, then they won't. And that's why bariatric surgery is not the easy way out by any means.